My talk today is going to be about what is digital wellness, how that connects to mental health, what that looks like in the pandemic era and beyond. And it's going to be more of a practical talk after we get into some of the background about what the pandemic has done for mental health in kids and like the kind of call to arms that we have in terms of how can we improve the lives of children who are really struggling with various mental health concerns right now. But then it's going to get into some like very practical details about how we empower families to think through how their children interact with media and technology and social media and all these things. And I'm hoping that people can take these things back to their agencies, to their schools, and think about some innovative ways to have these conversations with their communities. So Elizabeth said I'm going to introduce myself, so I am. I'm also trying to explain why is this Boston intruder coming to California to talk to you guys about this right now. So I'm an attending psychologist at Boston Children's. So I work with a digital wellness lab, as we were saying, but I also do a lot of clinical work. I work in two very different places, primary care and outpatient psychiatry. So in outpatient psychiatry, that's traditional therapy that you would imagine, kids with moderate to severe anxiety, depression, OCD, trauma, eating, those sorts of things. In primary care, we're breaking barriers because we're doing integrated behavioral health care. Pediatricians, social workers, psychologists, psychiatrists, we all work together to assess, refer, and treat a very diverse, very psychosocially stressed, and very socioeconomically stressed population in the Boston area. I'm also involved in teaching and training. One of the things that I'm going to talk about is the fact that part of the mental health crisis is because we don't have enough providers to attend to all the kids who need services. So being a training director for our psychology internship program is so important to me because these are people who are at the end of a long process. They're at the end of getting a PhD and they're about to launch into the world to do this work. And so being able to train them is really, really fulfilling. And then because clearly I don't have enough stuff going on, I also have a private practice where I do a lot of more like kind of boutique work with children, teens, young adults, families, therapy, consultation. But the thing that I think might be a little bit different about how I approach this is that whether you have Medicaid and you're seeing me at primary care or you're paying me private pay to see me in private practice, you're getting the same level, you're getting all of me, you're getting the same level of care. So that's the level that I'm trying to bring to all the work that I do. And that's also how I approach this idea of digital wellness, that everyone deserves that same high quality evidence-based level of support. So yes, as I said, we'll talk about the pandemic, pediatric mental health, what does digital wellness mean, how can we help families have this, and I hope to have some time for questions as well. So, it's 2022, 2 years ago the pandemic began, and we're in a place where I can stand in front of you and speak in person. This is the first in-person talk I've given in years, right? But we have to kind of remember where we've been and the things that children lost during this time. It's important to kind of know what they lost to understand why they're so addicted to their phones. So think about it from that perspective. The idea of health and safety. If you're a biologically healthy kid, you're not thinking about getting sick all the time. That shouldn't be a part of your mental headspace, but during COVID, it had to be for everyone. We've talked a lot about this, right? What the lack of in-person schooling did. Teachers have done such a heroic job of trying to pivot, but a lot of those soft skills that kids, I hate that word, but you know what I mean, the things that you get from actually being in a room with each other, they weren't able to have that. The old way of life, there are lots of things that needed to be overhauled about the old way of life, but there are so many things that children missed out on in this current setting. Accessibility services for kids with neurodevelopmental challenges, physical challenges, all those sorts of things. Those had to be halted, interrupted, altered. Bereavement. I'll talk a little bit more about this, but so many children lost primary caregivers during the pandemic. Racism and xenophobia. So many children from underrepresented minority groups were impacted by both these things. 2020 also marked kind of the racial reckoning where we finally were talking about systemic racism in our country, and also marked a lot of horrible anti-Asian hate. So a lot of children were experiencing feeling really like, what does it mean to have this marginalized identity in my society? The economic losses, we know what that means for kids' mental health, education, academic health, all those sorts of things. Social connectedness. I was reading an article recently that talked about it's kind of good to learn how to be alone, but you shouldn't be lonely. Spending time by yourself is a healthy thing, but a lot of kids were not feeling socially connected, and that is a mental health crisis in and of itself. extracurricular activities give so many kids a sense of purpose, a sense of teamwork, a sense of there's something I can do beyond this grade on a piece of paper. And a lot of kids had to have these things canceled. They lost, they didn't have the opportunity to be in person, these sorts of things. And then just all those milestones, right? Everything from like the weekend birthday party to graduating from high school, it didn't happen in those same ways. So when you think about all the things that kids lost, it makes a lot of sense that people would end up playing video games in their room all day. And so what did that lead to? Some of the things we've been talking about today, right? Emotion dysregulation, just the inability to like understand how to have a hard emotion and regulate your body. Behavior problems. Sleep has been a theme today, so sleep disturbance. When you're up all night on your phone or your whole schedule is kind of impacted, you would end up with lack of sleep. That loneliness I was talking about, grief, and then some mental health concerns like anxiety, depression, eating disorder, substance use. I'll just touch quickly on the eating disorder one for a second. So a lot of kids experience just a loss of control. All the things that they kind of thought meant the rhythm of their lives were kind of impacted, but food was something people can control. And then you have the internet and media talking about people gaining the COVID-19 and how to manage all these things. And a lot of kids took all that to heart and ended up with eating disorders. So we've got like a rapid rise in that, in substance use and anxiety, depression. And now we're starting to see what the results of that are in terms of who's utilizing the most intensive services. So in 2020, the proportion of mental health related emergency room visits amongst adolescents increased by 31%. And it wasn't like it was low before, but it increased by 31% compared to 2019. And then to take another little snapshot, from February to March 2021, emergency room visits for suicide attempts for girls went up 51%. This is horrifying. And then we have to think about the impact of the pandemic in terms of the bereavement component I was talking about with you guys. Children of color are more likely to have lost a primary caregiver, and when we think about what that means for their mental health, their social well-being, their financial security, and then when you consider the fact that children of color are more likely to be misdiagnosed, underdiagnosed, not have access to the higher quality services, this is really an important part of this problem. And as the president of the American Academy of Child and Adolescent Psychiatry said, we're caring for young people with soaring rates of depression, anxiety, trauma, loneliness, and suicidality. And this will have lasting impacts on them, their families, their communities, and all our futures. This is very, very critically important. So important that these three groups join together to have sort of a declare a national state of emergency in children's mental health. That we were already having a hard time before, but it's to a place now where we need to think of some innovative solutions, some of the stuff that we've been talking about here today, to figure out how to help the most children before things are too late with this. So that's pretty doom and gloom, right? So how does digital wellness fit into this? We're shifting gears. So one of the things that's super important to think about is that digital life is part of kids' life. This is something that's going to be here for better or for worse. We have to figure out how to make it be for good. But I'm going to do some definitions first. Digital wellness is an intentional state of physical, mental, and social health that occurs with mindful engagement with the digital and natural environment. And so like when I first started working with the Digital Wellness Lab and thinking about these things, it appealed to me immediately. And part of it, I think, is just my unique place in life as I've been in this work, right? I'm a millennial. I kind of grew up with some of this technology. I remember a time when we didn't have it, but my whole adolescence and adult life has had these components to it. I use tech in social and professional ways, especially through the pandemic. Part of the way I was able to get so much of my message out there was with doing Zoom and Google Meet webinars and figuring out different innovative ways to do virtual mentoring for underrepresented youth to hear about healthcare careers, things like that. I was just trying to figure out different ways to stay connected. And then I'm also a mom. So I have a 4-year-old, and that meant that she was 2 in 2020, and my husband and I were trying to figure out how are we going to parent and do our work and not have her be on a screen all day, and how do you balance all these things? And I wanted to learn about it for personal and professional reasons. So when we're bringing these two things together that I've been talking about, right, this crisis of mental health that we're in and the idea of digital wellness, one of the things I've been noticing across all the different types of kids I work with is that The way children engage with technology and digital media and the way their families respond to that has a significant impact on their mental health. Think about the kid stuck in their room playing video games all day, or the kid who falls down some social media rabbit holes into some really negative content. How do parents react to that? How do families know what to do about that? There's a lack of understanding of how do I even approach this stuff. It's scary, I didn't grow up with it, I don't know. We need to figure out how to help people deal with this stuff, which is where the Digital Wellness Lab comes in. So our founder and leader is Dr. Michael Rich. He calls himself the mediatrician because he's a pediatrician who came to this work through like film and being in kind of the entertainment industry. And the thing that I was so drawn to when I started working with him is that he comes from in this place of empowerment and positivity. He talks about this moment as an opportunity. We have an opportunity to change the conversation, to regain control of the screens and media our kids are growing up with, to harness them for healthy development and social engagement. This is why I was saying it's not all doom and gloom, right? It's like we can use what we have to do something positive. And that's what I've been doing. This is a way that helps me feel like I can take my clinical work and connect it to getting this message out to the most people, because I can see one kid every 45 minutes, but I can talk to lots of different communities, families, organizations about digital wellness, and that can have an impact on kids' mental health in this bigger way. So there are two main questions we think about a lot when we're at the Digital Wellness Lab. The first one is, can we develop new technology that nurtures creativity, empathy, and well-being? Some of the stuff that Goldie Hawn was talking about just a few minutes ago. And then second is, how can I best raise healthy and smart and kind children in our digital age? Those emotional intelligence skills, how can we make sure that kids are still getting those in the digital age? And Elizabeth, you nailed this with this idea of digital wellness being like nutrition and exercise. Like, it's like almost like you knew this slide. This takes effort. It's not an end state. You don't get to a place where you're digitally well. It takes effort. It's hard, like eating well or working out, but you have to be balanced. Too much, too little is not going to work. You can't just throw your kid's phone in the garbage, but they can't be on it 24 hours a day either. The balance is so key. So one of the things that we really, really, really like to do is to just empower families. And one of the things we do to do that is to provide a lot of free resources. There's webinars that we do, and then there's this guide that we call the Digital Wellness Guide. I'm going to talk to you guys through some of the aspects of the 2022 guide, so you'll be like the first people who have heard about this in person. It just was published. Basically, the things that are super important is to help families feel like they can be empowered to figure out how to navigate the digital space with their kids of all ages, from babies up to the young adults, right? And we give people an understanding of like what are the different apps that kids are on. What are the different pitfalls of these? What are the positives, the negatives, all that kind of stuff. And then we talk about how the science tells us that we need to engage with kids at different ages around these technologies. Two biggest things, and I think that we've talked a lot about that, how focusing on the individual children. No two children are the same, even in the same family. Two 12-year-olds are not going to necessarily engage with media in the same way just because they're both 12. You have to tailor things to the individual child, and that's where the empowering families come in. Yeah, maybe your friend's kid has this, but if you feel like that's not right for your family, that's something to talk about. And there are so many other factors beyond just what media kids use that impact their digital wellness. Some of the factors we've been talking about today in terms of learning challenges, socioeconomic challenges, cultural factors, all these different things impact how kids engage with this media. All right, so I'm going to walk you guys through some of the the highlights of these various parts of our guide, and we're going to start with the smallest ones. I think we're going to hear a lot of more interesting information about early childhood during the rest of the conference, but I'm going to dive into it a little bit just to help you guys figure out how are ways that we can talk to families of the youngest kids about this. So birth to age 5 is this time of just rapid development in so many ways, as we've been talking about today, right? The neuronal synaptogenesis of like learning all these different new skills of language, of movement, socio-emotional skills. Kids go from not being able to speak to having very complex language, from not being able to make social connections to being able to say someone's their best friend. There are so many important aspects of life that are happening from 0 to 5. And so we have to figure out, okay, where does technology fit into this? So for the under 18-month-old kiddos, the little babies, we try to recommend to limit the use of digital devices completely. And like for some people that might be like, there are people with 18-month-olds on digital devices, but you'd be surprised. Like people have to figure out how to navigate various things, and some families are not understanding that this might not be the best thing, but we can help them by teaching them some of these skills, right? We try to say that under 18 months, video chatting with family and friends should be the primary way that a kid ever sees a phone. When they start to go into those toddler years, screen time can be expanded to include some child-centered programming with an engaged caregiver. That's the other piece too, that this idea that like a kid is not going to be off on their own at 2 with an iPad. There should be some oversight. As they get a little bit older, they can have even more interactive media for short periods of time. But we talk a lot about receptive versus active screen time. So receptive is just watching TV, right? Streaming something, versus active, chatting with grandma on the phone, on FaceTime, or playing a literacy game, those sorts of things. But the goal is 2 hours, but again, that's a goal, because we know that as the kids get older, so much of their time is gonna be on media. When the goal right now is to play, trying to keep it under 2 hours is the key. So what does this look like in practice? So we talk about how digital media should be a time to actually talk to your kids, not to have it be something that distracts, but to have a conversation with, for it to be a time for physical closeness for families. This is super important. The idea of limiting your own screen time, right? It's very easy to say that your kid is on the phone too much when we're talking about older kids, but it starts young, right? Modeling that, I put my phone down, we have conversations, that sort of thing. The use of video chat as an opportunity to connect. It's not the same, obviously, as in-person connection, but I think that we saw during the pandemic that it can be so vital both for extended family and for the child to feel connected. Interactive media, like I was talking about, this idea of there being games and interaction versus the sort of passive, I stare at the screen with my mouth open sort of thing. To that end, observing how children look when they're watching a screen. Are their eyes glazing over? If that's the case, it's time to pivot to some other activity. I feel like the theme of today has been about sleep, but turn off screens at least 1 hour before naps or bedtime. It's really hard to downregulate when you've been in that sort of active screen time state for these little ones. Addressing representation and diversity in media, and I think this is important for everyone, not just kids from underrepresented minority groups. If we're going to have kids this age using media, use it as an opportunity to show them different people of all different shapes, colors, sizes, ability levels, and using that as a way to start representation early. I think that's a really positive way to use media that we advocate for. This is very important. Avoid using screens to comfort children or to regulate their emotions. The thing that's super important is that people need to learn, right, that everything they need to calm themselves down is inside them. Everything I need is in my body, right? So helping support your child through learning how to calm down, to relax, these sorts of things, without shoving a screen at them is something we really try to advocate families do. And then screen-free meal times. This could be for everybody. It's not just for little kids. The idea that little kids are picky eaters. It is easier to shove random vegetables in their mouth when they're watching TV, but that's not mealtime, right? The goal is to have as much screen-free mealtime as possible. And then parents for this age group should be, parents and caregivers are the main managers of the devices and the content. So moving into school age, we know that these kids are learning how to read, developing literacy, figuring out their place in terms of their self-concept and their social connectedness. For the tweens, how they present to their friends and how they fit in becomes even more important. And this is when the social media stuff starts to, I think, become something that parents want to ask a lot of questions about. So this is where we start talking about this being a conversation versus the parent coming down from on high, right? They're still in charge, but they need to work with their kids to determine what devices do we use in this house? What content do we consume? And who do we connect with? And screens should be used in moderation, with purpose, and in balance with time with non-screen activities. The screen is not so bad as much as what you're not doing because you're on a screen. Same thing for the tweens. We recommend that families work with them to make these decisions, continue to monitor their use, and have clear expectations and boundaries. I think because some of this is such uncharted territory for families, they don't know, like, what do I tell them about how much TikTok they should be on? I don't know that much about it. I think it's important to try to figure out together what the expectation and boundaries are. And again, what does that look like in practice? So these sorts of conversations with kids about what do you want to use, why do you want to use it, what are you going to do on it, can we continue to talk about it? That's going to be super important. Setting up accounts with the kid. There should be no secret private accounts that parents don't know about for this age group. Having open access to their child's presence from the beginning. This is not about snooping, and I think that parents need to learn to speak different language about it. It's about, I need to be able to see what you're doing and interact with you about it and have conversations with you and put a boundary up if you need help. Some people talk about making a formal shared media use agreement, right? So like it could be a contract or it could be just household rules that you have about how we use this media, what age you're going to be when you get this account versus that account, when do you get a phone, that sort of thing. Dr. Rich loves to talk about this because I think he likes video games a lot. The idea of, like, for some families, gaming with kids versus it being something that they do off in their room that you have no interactions with or understanding of. And a lot of families have been surprised that they really enjoy this and it becomes a family activity, which I think is super cute. And developing media literacy together. I talk about this a lot. You don't understand and you can't control what you don't know, right? So researching apps, researching websites, researching the influencers that kids like, right? Like, I think family feels so removed from this, but it's interesting and fun, but part of the reason I think this is so important is that developing that literacy about what is on the web together makes it easier to have those conversations with kids around boundaries. Cyberbullying is a super, super important thing to have constant discussions about. I think as a society, we talk more about bullying and victimization in general, and I think that's really good. But I think cyberbullying has kind of been in the shadows a little bit because it's not a school-based thing necessarily, but it can really impact kids' academic health. So I think making sure that families know about the dangers of cyberbullying, what it is, how to help their kids, how to go to the school about this is super important. Basically, any behavior that in real life would be complicated or troublesome should be addressed in the media as well. We talk a lot about being intentional about smartphone use, right? Like, smartphones are so ubiquitous, people just think, okay, I just have to get one for my kid. But is your individual kid ready for this? Is it a matter of, like, everyone else at school has one, or do you feel like your child is ready, or they're begging you so much? It's important to be intentional about what your goal is for when you give this, because you're putting a very powerful device in someone's hands, and you can't really put the genie back in the bottle after that. Social media, same thing, only when kids are ready. And what ready looks like for one family might not be ready for a different family. This is super important. I've actually been having some really interesting conversations with people about this in the past couple of days. Unfortunately, for some kids, internet pornography is like their introduction to sexuality. And you can think about all the negative sequelae that would come from that, right? So a lot of parents are like, I'm not talking to my tween. I don't want to talk with my 10-year-old about this. You probably should, because they're probably already seen it. Unfortunately, that's the reality of it, because I think kids need to know that that's not real, and they can't know that if they're not having conversations with their family about it. And then that balance thing, I'm going to say that over and over. It's not that screen time is bad. It's the lack of things in the natural world. So if screen time is taking away from someone's ability to participate in the rest of their life, that's the actual problem. So now, thinking about teens and young adults. So this is a time of, maturation and then moving off into the adult world on your own. But kids still need support from their parents about this, as they're the digital natives. They're like the original people who have been on the internet their whole lives. But they need to figure out how they're going to navigate adolescence and adulthood with these tools, and to address all the pitfalls that can come along with it. So one of the things that's important, like I've kind of been saying in different ways, is that screens and interactive media are a part of teens' social lives, their education, their entertainment choices. This is here to stay. But it's important to talk about what experiences people are having and the choices that they're making online. Boundaries and intervention when necessary are important as well. because the goal is lifelong digital wellness. The habits you're making as an adolescent are going to follow you into adulthood. And then when your kid is an adult, they still benefit from talking about healthy screen management, safety on the online world, and empathic treatment of others, that empathy that we've been talking about in other talks today. So digital management skills, that means figuring out how to take charge of your own habits with social media, with technology. This is where it's important to move from a place of the parent is in charge to like working with the teen together to decide, do you use the screen time limits on your phone? Do you put your phones in the basket when everybody goes to bed and no one has them in their room? Do we use an alarm clock versus the phone for getting up in the morning? These are the ways that you kind of develop that digital management. It's not about taking it away, but figuring out how to use it. Kind of updating that shared media use agreement that should start in the tween years. Addressing the dangers of sexting. This is connected to the pornography point that I was making on the other slide. This is a very, I've talked to families about this a lot. It's a very uncomfortable topic for families. They don't want to think about it, but because so much of teens' life is on media and on technology, this is sometimes a part of their relationships, and telling them about the dangers of this, the fact that these pictures can live forever, the fact that somebody can send them to other people without your consent, the fact that transmitting them to other people counts as child pornography. Kids don't necessarily know this, and like parents need to talk to them about it. Another thing that I've been seeing clinically is a lot of my teenage girl patients talking about feeling pressured to send these images, even if they don't necessarily want to. And so that's another conversation. That consent is an important part of the online world too, not just the physical world. Same thing about cyberbullying and negative behaviors. It's important for families to continue these conversations into the high school years, because when we're thinking about cyberbullying, a lot of the trolls on commenting sites and people like that are adult versions of this. So helping young people to understand this at an earlier age and think about how they interact with people online. And if you wouldn't say that in person, should I say that on my phone? That's an important thing to think about too. Critical decision-making and problem solving. Sometimes kids come into issues with figuring out how to handle their digital use, and working with them to problem solve it together, to use those executive function skills to figure out how I'm gonna handle this problem or how I'm gonna move forward is super important. Modeling healthy and appropriate behavior. Dr. Rich often says, teenagers don't listen to anything parents say, but they watch everything that they do. So if a parent is having a hard time with their digital use, this is going to be problematic for the kid. Modeling that healthy behavior is super important. Talking about the dangers of cell phones in the car. I think that since they've had them all their lives, it just feels like an extension of their arm, right? But the dangers of texting and driving and these sorts of things are conversations families should be having and schools should be having. Same thing with online dating. I think when people feel like they've had this interaction of like, I've been talking to this person for hours and hours and months, and now we're gonna meet in person. I feel like I know them, but if they're still a stranger to you, all the rules of meeting someone new apply. Being in a public place, letting people know where you are, having those sorts of kind of parameters, because it's easy to feel like this person is familiar to me because we've been having this internet interaction for so long. This is also where the balance between privacy and boundaries and safety come into play. It's not about snooping, it's about helping people feel like they are developing their sense of autonomy while still helping them to stay safe. Media literacy. We live in the age of misinformation and fake news, figuring out how to find where are those balanced pieces of information, where do I look for the evidence base? Do I believe this just because it's on the internet, just because I saw it? How do I find out the right answers here? And then, again, sleep. The blue light from phones can really impact people's sleeping patterns. The people who need the most sleep are like babies and teenagers. Teenagers are getting way less sleep these days than they used to, and this has so many negative impacts on psychological health, academic well-being, all that kind of stuff. This is a very challenging topic for families, and I think this is where some of those digital management skills come into play of what are we going to decide to do as a family about how we're going to balance this so that we all get the sleep that we need. So these are best practices. They're not one size fits all. They're kind of general guidelines that we use to approach families with in terms of how they can work towards being digitally well. I think they're particularly important for kids with mental health concerns because it's so easy to utilize a screen to kind of put a Band-Aid on some like anxiety, depression, or what have you. But learning how to use these sorts of best practices help kids to live in that balance. And I think that, I hope I was able to talk to you guys enough to convince you that digital wellness is a part of that whole child approach. I think that it needs to be something that we're thinking about in terms of kids' physical well-being, their emotional well-being, and their academic well-being. And I think that if different stakeholders can come together, whether it's in the education sector, the nonprofit sectors, to start utilizing this sort of language around digital wellness and how to make this happen, I think that's going to help children to thrive and to kind of take that whole child approach that we need.